For the past couple of weeks, I've been talking about fibroid tumors. I've been telling you about symptoms. And it occurred to me that that's not necessary. I don't need to tell you what you already know, meaning you know about the bleeding. You know how bad it could be. You know how you have to double up and bring extra clothing items to work just in case. You know what it's like to have to work and be concerned about not having an accident. You know about the discomfort of having a large mass in your abdomen and pelvis. You know about the pain with sexual activity. You know about the shame. You know already about the questions and the concerns that you have about, can I get pregnant? Will this affect the pregnancy? And do I really need surgery? And so I feel that I need to stop talking at you about things you already experienced. Rather, I want to talk to you. I want to say that I have seen your pain. I have heard your stories. You are operating day to day under circumstances that are much less than desirable. And it seems as though no one is paying attention. And you may wonder, am I alone? Do I have to be this strong Black woman dealing with something that when I wait, I'm told to wait. It's a funny situation. I'm told to wait. And then when it gets bad enough, I'm told my only option is surgery. Isn't there something better? I hear the question. I hear your question. And I am here to say that it appears that it doesn't have to be that way. It appears that our understanding about fibroids is actually expanding. And that's a good thing, because even though Black women are disproportionately affected with fibroids, we are not the only women affected with fibroid tumors. It is a global issue. And more people are starting to question, what can we do proactively? Are there things that we can advise her to do that will help her before she gets to a state where she's severely anemic, before she needs IV iron infusions, before she has to make the decision about, do I get pregnant now even though I'm not married, because I want to have children, but I'm afraid that if I wait, the only option is going to be a hysterectomy? Or do I wait until I am so tired of having to deal with this situation month after month after month that I am now willing to say, just take it all out. And that shouldn't be the case. Meaning, you shouldn't have to be driven to despair. You shouldn't feel as though there are no options available to you except a surgical procedure. And you shouldn't feel as though no one is listening. You shouldn't feel as though you're all alone. You shouldn't feel as though you need to be this super woman. I'm here to say you're not alone. I am here to say that things are changing. Preliminary studies are suggesting that something as simple as vitamin D may help to slow down the growth of fibroid tumors. There are some places there are some countries that are looking at giving vitamin D supplementation to women who are deficient proactively before they have large fibroid tumors, before they are symptomatic, to help to reduce the likelihood of the fibroids becoming problematic in their life. So there is research being done. It's slowly evolving. Women are starting to talk more about their circumstances, i.e., the recent conversation from Lupita. Lupita said that she had 50 fibroids. How does one woman get 50 fibroids? And it makes you start to wonder, so maybe this isn't just an isolated thing. Maybe it has to do with the uterus itself. Maybe there's something about the uterus that's making it more likely for a woman to develop fibroids. Maybe there is a permissive uterine environment that predisposes women, or a particular woman, to developing multiple fibroids, to a particular woman developing fibroids which tend to recur. And these are very, very important questions which are now increasingly being studied and researched. And so what I'm saying to you is, you are not invisible. I see you. You are not alone. In fact, you are integral to this process of understanding fibroids. We need your input. We need to hear from you. We need to know so that the right questions get asked, the right decisions get made, that you have an input. And to that extent, I am inviting you to participate in a very easy, simple 2-minute survey. The link is going to be below. To share your experience. And it's the start. It's not the end, it's the start. But it's me saying to you, I'm no longer going to talk at you. I want to talk to you, and I hope that you will join in the conversation, because this is a very important time. Very important time, and it's time for us to make a difference.